Effectiveness of mental health services for the emotional and behavioral disturbance population by Jennifer Wodzinski. The emotional and behavioral disturbance population is one of the most underserved in special education. There are many reasons why this is true, but one of the most profound is that a significant level of training and skill is required to appropriately handle these students. Mental health services, in particular, must be utilized consistently and appropriately in order to have the most positive outcome on this population. The issue is that a lot of times counseling and other therapeutic activities are put on the back burner while academics and testing is put in the forefront. The key is to properly balance both academics and therapy to ensure the student's success both in school and in the community. The following are 5 articles that discuss mental health services and how they are used with the emotional and behavioral disturbance population. In this article, the author discusses the importance of mental health services for adolescents who have emotional and behavioral disturbance. She also discusses the specific therapies that have been successful when working with this population, including multi-systemic therapy, brief strategic therapy, dialectical behavioral therapy, and motivational enhancement therapy. As violence has increased in high schools, it has become important that schools play a role in promoting students' well-being. Even though most youth do not receive adequate mental health services, those who do often receive them through the school system. And the most successful outcomes are when wraparound programs are put into place. Researchers believe that for the most part, educators believe that poor mental health is directly associated with decreased academic performance. The 5 components to successful treatment are skill development focus, problem-solving focus, continuous assessment of progress, homework, and positive therapeutic relationships. This article talks about therapeutic activities used with the emotional and behavioral disturbance population at an alternative school so that they can acquire the knowledge and skills necessary to become responsible citizens. Each student's IEP is highly individualized, and all students receive therapeutic interventions focused on increasing their sense of self-competence and empowerment. The staff at the school uses a variety of programming to facilitate positive growth and create a safe and caring environment needed for success with troubled children. They work closely with the students' families to increase effective communication in order to successfully deal with maladaptive behaviors. The students participate in pro-social groups, vocational training opportunities, and daily character education classes. All of the clubs, peer mediation, pet training, and emphasis on academics help to develop the student's sense of competence. Overall, the students in this program appear to be making significant progress, and most importantly, the students feel as though they are making progress. The staff believes that in order to continue this progress, the key is to maintain and enhance their commitment to student empowerment. This article discusses the results of a study done on effectiveness of group counseling in adolescent females. Due to girls still being a small percentage of the delinquent youth population, there is still little or inadequate counseling and intervention services offered. It is suggested that the most appropriate programs for this population are gender-based, holistic, and focus on girls' health attitudes, behaviors, and lifestyles. It is important that girls focus on developing their strengths rather than improving their weaknesses. Since relationships are important to adolescent girls, group counseling may be an effective intervention for those at risk for delinquency. Girls learn how to safely communicate their emotions and improve their assertiveness in order to develop and maintain healthy relationships. article discusses a 5-year study done on the effectiveness of mental health services on students in an alternative school. The study focused on two things: how successful was the program at improving the students' social and academic functioning, and at improving dropout rate, removing chronically disruptive students with drug and alcohol problems from traditional public schools, and providing social services. On a regular basis, each student received individual, group, and family therapy, teacher phone conferences, staffings, and transition services. At the end of the study, it appeared that the alternative school was successful at improving psychosocial functioning and academic performance of chronically disruptive students. Mental health services in alternative schools was the only study I found that did not result in a positive correlation between mental health services and school performance. The author reported that based on the results of the study, receiving mental health services did not predict school success. In fact, the results showed that the group that did not receive mental health services actually had a higher average GPA and less disciplinary actions. However, the group that received the mental health services did have fewer absences and a lower dropout rate, which was completely ignored in the discussion of the author's results. The first 4 articles discuss the positive outcomes that mental health services have on the emotional and behavioral disturbance population, while the 5th one shows that it does not have a positive effect. However, the way the authors define success and measures its outcome varies from one article to the other. The first article discusses what the authors believe are the most successful forms of treatment for the emotional and behavioral disturbance population. The second and third articles focus more on developing empowerment and general emotional well-being and wellness. The fourth article, even though it is still positive about mental health services, focuses on improving academics through good mental health. The last article was the only article I found that did not have a positive attitude toward mental health services for the EDBD population, especially in alternative schools. This was likely due to the inconsistent results found in the 4 areas they calculated. In my opinion, the ultimate question is what has the greatest long-term effect on the students: academic achievement or developing a sense of self-concept and self-actualization? As clinicians and education professionals, we are planting seeds that will grow later in life. A clinician's primary focus is not to directly improve academic performance, but to indirectly improve it through helping the student develop a sense of self-concept and self-actualization. We do this through helping the students develop their sense of identity and allow them to explore their strengths as well as their weaknesses. We have them develop a sense of empowerment, which will eventually lead to them achieving their full potential through creativity, independence, spontaneity, and a grasp of the real world. The issue is that this is not seen in the short term and often takes many years to accomplish, which is why short-term studies done on the effectiveness of therapy will not paint an accurate picture of its results on academic achievement. Even though measuring students' well-being is harder to report on because of its subjectivity, it's a more accurate way to determine the effectiveness of counseling than objective ways like GPA, disciplinary reports, and dropout rates. The following are the articles I used for this presentation. Please feel free to look them up and get some more information. Thanks for listening.